Good afternoon, my friends. Happy Wednesday. The doctor is in the house. Welcome back to another episode of To Your Health with Dr. G on this great day. Hey, I'm so excited to welcome you back. We're going to bring the thunder, bring the noise today. We're here back in studio, and this is going to be just great. I know you all are waiting for this. Last year, I debuted my Countdown to Summer series, and I'm bringing it back better than ever. I'm talking about Countdown to Summer. We only got a few weeks left. We're going to be talking about last minute prep. And this whole series is about the last minute things that we can do to not only make sure our summer health is great, but we're looking for a foundation to continue to keep your summer health going now and beyond. And I'm so excited to welcome everybody back because today we're going to be talking about last minute beach body prep. You know you want that beach body, you know you want that perfect look. There's going to be some great tips that we're going to talk about today to make sure you're looking great for summertime and beyond. Remember, at the end of the day, it's foundational. We want you to have good health because as you have good health, you're more than likely to have good opportunities out there in life. And so we're going to keep bringing the message today. I tell you what, my panel is fierce. Some of them have been on the show before, some new guests, but I tell you what, each of them are experts at their craft, and I cannot wait to hear some great information about trying to make sure we look good now and beyond. And again, summertime's coming up in a couple weeks, so we got to hurry this up. So we're going to have, for the next 3 weeks, we're going to bring some great content, things that you can apply immediately to safeguard your health now and for the long term. So I'm so excited to bring you guys back here. Check me out on my website, www.drmarkgomez.com. We're here on Facebook Live. We're also here in studio at Intellectual Radio. I tell you what, countdown to summer. Everybody wants that beach body. I want that beach body. And I worked out this morning, so it's good, so that counts. We gotta make sure we're gonna talk about the fitness, we're gonna talk about the nutrition, we're gonna talk about the lifestyle, we're gonna talk about any other thing that's gonna help you stay healthy now and beyond. So I'm so excited to welcome everybody back. At the end of the day, what I want you guys to take away from this show is I want you to take away some good points that you can apply immediately. But at the end of the day, remember, talk to your doctor, talk to your healthcare team. They want you to get to your goals, and your goals are gonna be very attainable. But make sure you make that call. If there's any questions at all, call your doc, call your healthcare team, and they will lead you to that goal. They want to see you succeed. Everybody on this panel today wants to see you succeed. But again, here we are talking about beach body prep. So I'm excited to bring this to you. So you guys are going to meet my guests in a few moments. What I do each and every week, of course. Those of you that are new to Your Health with Dr. G, and of course, thank you for those that follow us all the time. What I do each week on the show, I invite a group of medical experts, and we talk about health and wellness tips to make sure that you have the tools for success. So I'm so excited to welcome the panel today. Before you guys meet my panel, of course, I got to hit you with a quick disclaimer. The content of To Your Health with Dr. G is for informational and entertainment purposes only, and that the content is not intended to be a substitute for professional medical advice, diagnosis, and or treatment. Further details can be found at www.toyourhealthwithdrg.com/disclaimer. So here we are. We're talking about beach body. We all want it. We all want to look good, feel good, but we're going to talk about the ways to get that. We're going to talk things about diet fads. We're going to talk about obesity. We're going to talk about nutrition. We're going to talk about fitness. And so I'm excited to welcome the panel. So here we go. I want to introduce you guys to my guests. My first guest today on the show, he and I have known each other for a few years now. We actually met through working on diversity through our mutual hospital, working with the System Diversity Council. But he's an expert in his craft. He's seen a ton of my patients. Again, I'm always going to have people on my show that I send patients to, people that I would see myself if I need to. So again, you're always going to get the right people that are experts at their craft. So I want to introduce my first guest, Dr. Omar Shamsi. He's a board-certified medical bariatrician. He's medical director at Endeavor Health Weight Management, Edward-Elmhurst Health. Check him out at www.eehealth.org. Dr. Shamsi, welcome to the show.
Thanks for having me.
Hey, give us a little bit about your background, where you went to school, where you did your training, and what does today's theme mean to you?
Sure. So I'm originally from Chicago. I was born and raised, and so it's a pleasure to be here. I did my internal medicine training over in Detroit, Michigan, and I went on to complete a obesity medicine fellowship over at the Geisinger Medical Center in Pennsylvania. After completing my fellowship, I came back to Chicago, and now I feel like I'm giving back to my community.
Excellent. So I'm so excited to welcome you onto the show. Again, we've worked a lot clinically, and I'm glad to have you here so we can talk a little more logistics and really some relatable terms for people out there so they can take to their and apply in their lives. So thank you for coming on out.
My pleasure.
My next guest, he and I have known each other for a long time. He's been on the show before. We've hung out professionally, socially, and so we have a great relationship. He's seen a ton of my patients as well too. I want to welcome back to the show my good friend, Dr. John Bull. Let me read you his credentials because his credentials are deep. Dr. John Bull is a board-certified plastic and reconstructive surgeon, founder and owner of the John Bull Center for Cosmetic Surgery and Laser Medi-Spa. Check him out at his website, www.dupageplastics.com. Dr. Bull, welcome back to the show.
Thank you so much. It's great to be here.
Hey, I'm excited to have you back here too. Why don't you give us a little bit about your background, where you did your medical school, where you did your training, and what does today's theme about Beachbody mean to you?
Sure, absolutely. I went to medical school at LSU in New Orleans. Then I did a 5-year general surgery residency at the University of Georgia Medical College in Augusta. And then I came up to Loyola and did a 3-year fellowship in plastic and reconstructive surgery. And I've been out in Naperville ever since then for the past 16 years. This is the most exciting time of the year for me because I see people in every stage of fitness and body contouring to help improve them for the rest of their lives, not just for the summer. You know, we want to make this a long-term improvement. And having a team approach, I think, is the best way to do it.
Excellent. Well, thank you for coming back onto the show, Dr. Bull. My last guest, he's joining us via the phone. I met him last year. We've developed a great friendship. He used to kick my butt literally as a personal trainer, really helped me jumpstart my health and really getting me to my health goals. And so I'm excited to welcome him back. I want to introduce you to my good friend, Kendrick Butler. He's a personal trainer. Check him out on Instagram at FitLifeKen. Kendrick, welcome back to the show.
Thank you for having me, Doctor.
Hey, it's great to have you back here. How's the weather down in Florida?
Hey, no complaints, but I think the humidity is getting to me. It's a little hot.
Well, Kendrick was involved. We did a little bit of pre-marketing on this show, and so actually I put a video out there for Kendrick and I doing a House Calls with Dr. G segment on Monday. Check that out. Great tips from a fitness standpoint. We're going to get into some more tips today, but check out that 8-minute video that we did. It was great. So Kendrick, welcome back to the show. Give me your thoughts about just Beachbody. What does it mean to you? We're talking about countdown this summer, getting your body back in shape. Give me a few opening remarks.
I would say that if you're looking for, the ideal beach body, I think it's a matter of comfort. So, you want to be able to get your self-esteem and your confidence up to a level where you can take your shirt off as a male and walk around on the beach comfortably with confidence. And as a female, be able to wear a bathing suit with confidence. So it's not really essentially the same goal for everybody, but we want everyone to feel confident in the way they look and confident in the way they feel. That's what Beachbody means to me.
Excellent. Thank you, Kendrick. I look forward to talking to you a little bit more on this program. So here you have it. You guys just met the panel. And the reason why I wanted to assemble the panel like this, again, we have an obesity medicine specialist who's excellent at his craft. We have a plastic and reconstructive surgeon who's excellent at his craft. And we have a fitness expert who's excellent at his craft. And me as a primary care physician, as an internist, I think what we can do together is talk about a lot of synergies. At the end of the day, when it comes to your health success, it's about a teamwork. It takes a village. And so I surround myself by multiple practitioners to help me keep my health going, and I want you all to have those same resources too. So thanks again, everybody, for taking time out of their busy schedules to come today and give some knowledge. So here's what we do on the show. You just met the guests. We always start with a chief complaint. The chief complaint, of course, is when people come into the office, they talk about what brought them in that day. Our chief complaint, aka the question of the hour, is what are the best lifestyle tips to get your body ready for summertime fun? So I can't wait to talk a little bit deeper about this. Again, we're trying to put in that work ethic. Now, the old saying is that to get that beach body, it starts in the winter. But hey, we only got 3 more weeks till summer. There's things that you can do now. But again, we're trying to set you up for not only now, but also in the future and beyond. So I want to ask this question to Dr. Shamsi. He's sitting closest to me, so he gets the first question. But really how it's going to work, guys, today that are listening, we're just going to have some general conversation. It's going to be, I want to talk about some of the key take-home points. But at the end of the day, I want you guys to make sure you have the right information. That's why I got these people here today, these professionals to help me out. So here we go. So here's my question for Dr. Shamsi. Most people want to lose weight not only as they approach summertime, but this is a sentiment expressed year-round. That's one of the things I get so often as a primary care physician. When I ask them, what are your health goals? Almost everybody says weight loss, weight loss, weight loss. So what are some of the current approaches that you incorporate on a daily basis as you counsel your patients on how to get healthy and drop some weight?
So the most important thing that I come across is, patients will say that they eat healthy and they're working out. It's important to go over that from A through Z. Like, what are you doing when you wake up? What are you doing for breakfast, lunch, and dinner? And when you start breaking it down in simple terms, breakfast, snack, lunch, snack, dinner, snack, you end up realizing they might be eating a little bit more than they should be, or maybe eating the wrong things, and without realizing it. It really is more than what you eat. It's psychological, it could be physical, it could be genetics in your environment. And so there's so much more to this than just what you put in your body.
Excellent. I always say weight loss is a very complex physiologic process, and there's no doubt that it is. And I think you're right. You have to have that education and lay that out at the beginning to say, hey, listen, we're going to get you to that goal, but it's not going to be a goal that's going to say, hey, it's going to happen overnight.
Absolutely.
We got to work towards that goal, but I love how you do that.
Absolutely. You know, I always tell my patients that this is not a race. It's going to be long term, and losing the weight's not the problem. Keeping it off is the hard part. And so that's why we work as a team. And it's the long term goal that we have together.
Excellent. Dr. Bull, how do you kind of approach weight loss in your practice on a day-to-day basis when you're working with your patients and your clients? What's your kind of general approach?
A similar way, we definitely talk about calories in, calories out, metabolism, and ways to boost that. I don't like to use a lot of medications because that's your department.
Yeah.
I want to focus on getting people into the medical weight loss program so that they can lose the weight before we do the fine contouring and anything else that needs to be done, because, well, I can use liposuction and other techniques for a jump start, and it definitely is very motivating. It's better results if you do it the opposite direction.
Well, you're hitting the head on the nail when it comes to lifestyle, and I think that's one of the biggest things. You have to have that lifestyle. So, we'll get into some of the diet fads in a bit, but if you don't have that proper lifestyle, that foundation, it doesn't matter what you do. We always tell people this. I always say, move more, eat better, stress less. If that, I got to practice my own words on that one.
Sure.
But if we can all do that, I think we'd be better off on things. But again, foundational. What's your thoughts about that, Dr. Shamsi? Just trying to have a good foundational lifestyle.
Absolutely. The first question I ask people when they walk into my office is, who do you live with, and who does the cooking? If you're trying to eat healthy and somebody else in the house isn't, it's going to make it a little difficult. Sometimes it's the spouse that's cooking, sometimes it's the mother-in-law. Everyone needs to be on the same page.
There's a good cardiologist that I've sent some patients to, Dr. Kim Williams, and his practice out of Rush Copley, and he would always say, whoever's cooking gets to decide what you eat. And so a lot of us, it's our wives that may do a lot of the cooking, and so it's like that's the person that gets to make the decisions. So it's very fascinating that you said that.
Or sometimes it's the husbands. Whoever it is, that everyone needs to be on the same page.
I think my wife would say that I probably do most of the cooking in the house, and she's listening to the show right now, but it's absolutely true. Kendrick, what's your approach from a general standpoint? When you think about just approaching from a fitness standpoint to people that want to lose weight, how do you start having that conversation?
Well, first off, if someone wants to lose weight, I leave a lot of the diet advice up to, professionals. But from a personal training standpoint, my job is to make sure and coach them to the best of their ability. So I'm going to always have them give me a food log of all the things they've been consuming from a beverage standpoint and from a food standpoint. And then from there, my job is to take those foods and put them in the right order so that they're getting the most out of it. And then from there, make simple adjustments. A lot of times it's just water consumption. As the doctor just said there, the calories in versus the calories out complex, and just making sure that I do the best of my ability before we recommend them to a physician or professional.
So let me ask this question to Dr. Shamsi, because I get this asked all the time. If somebody wants to lose weight, we're talking about trying to get that last minute beach body, yes, and there's usually a lot of weight loss, and we'll talk about some plateaus in a bit, but do you tell people diet, exercise, or both? How do you kind of approach that conversation? Because I know people always have that conversation.
Sure, no, absolutely. So I believe that they both complement each other. You have to eat well in order to live well, and so joining the gym is easy. Going is the hard part. So you have to, it's. I have many patients who will join the gym, but they have a million excuses. It's raining, it's snowing, it's too hot, it's too cold. Diet-wise, you have to, same thing. I'm busy, I have kids to take care of after work. They complement each other. Eating well, working out, when you put it together, you get the best results.
Excellent. Dr. Bull, from your perspective, from a plastic and reconstructive surgeon perspective, I guess you're trying to get people to have a look when they want that look. But how do you continue to do? What's your thoughts about diet, exercise, both? Are you in agreement with everybody so far?
Oh yes, definitely. Both is better, but I will say anything more than what you're doing now is a step in the right direction. Don't do it overnight. It's a long process. You don't want to, because otherwise you'll just burn out in 2 weeks. Anybody can lose weight over 2 weeks. It's the next 50 weeks out of the year that are important. So we try to focus on that.
Yeah, I always say, from an internal perspective, I always say, yes, you want to have both. I think they both complement each other well. From an exercise standpoint, of course, we're looking at the tonic effects, the tone, as you have muscle stimulation. But there's also other mechanisms involved. There's GI tract effects, signals that are sit-down appetite signals. There's obviously things like body composition. There's tone from there. There are other signals that come out. So again, we always talk about that. It's not a one-size-fits-all. You have to really have a tailored plan. But this is why I personally believe that somebody should have a multi-specialty approach. And I know, Dr. Shamsi, from your practice, you do involve the help of other clinicians as well, too, correct?
We do. We have a psychologist, we have a dietitians, we have access to an exercise physiologist. It takes a whole team to help somebody. And when patients come to see us, they've tried different diets, they've tried different exercises. So when they come to a clinic that helps, or a physician, they want to know what can you do that nobody else has. And they've tried every diet, maybe even perhaps medications. So you need a whole team to help this person out.
Kendrick, let me ask you this question, because I get asked this question all the time. So I know people out there listening want to know. It's like, hey, doc, I've increased my physical activity. I know I have. I swear I have. My Apple Watch tells me that. All these kind of devices say, oh, yeah, I did. I got 10,000 more steps. But my body weight is not moving. My body weight doesn't change. Or in some people, it's gone up. How do you kind of approach that from a fitness standpoint when your clients are coming in and saying, I've tried to do everything that you've done. I come here, I'm paying you money, I'm sweating like crazy, and I'm not seeing that measurable change?
Oh, yeah. Well, then we know exactly it has nothing to do with effort and hard work. It has everything to do with what they're consuming. So from there, we're going to do all the necessary, research to figure out exactly what we need to do to fine tune. And a lot of times, especially when your clients have been building a lot of lean muscle, they're not going to see a drastic change in their weight. They may lose a lot of the crud, a lot of the water weight that comes along with getting started and getting your body back acclimated to fitness. But for the most part, that muscle is so dense that you have to get them bought into not so much the pounds on the scale and focusing more on body fat. And then lastly, if weight is really, really an issue and that's their number one focus, then essentially they're not eating enough calories a lot of times, and their body is just storing onto a lot of things because they're working harder than the amount of calories they're intaking. So just getting ahead of that. So again, a lot of people work very, very hard at the gym. I personally feel like that's the easy part. It takes about 30 days for you to really start liking that again, but the hard stuff is what we're putting in our body, what we're not putting in our body outside of the gym.
Yeah, I think some of the things that I try to approach, I always talk about, maybe we need to adjust your macronutrient density, the nutritional choices, excuse me. Also, like, what is your response to when you have food? Sometimes if you eat something that's pleasurable, you want to eat more of it. That's just dopamine being released, and that's a reward system. And sometimes you have to adjust that. The reality is when you are exercising, the reality is the first moments of exercise, the first energy source that you're using is actually carbohydrate-based energy. So it's harder to those are things that are burning you to sustain that workout in the first place. So you're not going to tap into those fat stores that we all want to get into. You're not going to tap into that right away. You have to burn quite a bit of energy just to fuel your exercise before you start tapping into other resources. Dr. Shamsi, when you see patients that come in and they say, hey, I'm exercising, I'm doing this, and they get frustrated, how do you just kind of just coach them through that?
My thing is, it's not just about pounds or a number on a scale. You have to look at the big picture. If you're breathing better, if you're moving better, if you're feeling stronger, those are amazing, feats in itself. If your genes are fitting better, yes, you may lose some weight, but then you're going to hit a plateau. And during those plateaus, when your fat cells are shrinking and your genes are fitting better, that's also just as important.
Excellent. Dr. Buell, let's get into a little bit of some about, I talked a few months ago, people say, I'm trying to get this fat, but I'm not tapping into my fat source when I work out because, again, your first part of your workout, and I cannot emphasize that enough. The first part, when you're working out, you're burning through carbohydrate stores, you're not burning fat. You have to burn, and you have to use energy when you're working out. Your body requires energy, so you're going to get your first source of energy, which is your carbohydrate stores. Then you hopefully want to get into your fat stores, and hopefully not break down a lot of protein and muscle stores while you're doing that. But Dr. Buell, a lot of us have those stubborn areas. It's like, hey, I know that my muffin top, muffin top, or my love handles, and I'm working those areas. Where does what you do come in to help out with those stubborn fat areas? Can you explain a little bit more about some of the techniques that you guys are using?
Absolutely. There's if you're doing all the right things, there's usually some areas that could stand to be improved. we use several techniques. Liposuction is the most common, but that's a surgical procedure. It takes a small 4 to 5 millimeter incision. We put a cannula in there and remove the fat. You can talk about multiple ways of doing that with lasers and ultrasound and a power assisted machine, but they just suck those fat cells out, and then your body will shrink down to the smaller contour. But there's some downtime associated with that. Usually people take 3 days off of work before they go back to work. With that, you have to wear a compression garment to get the skin to redrape to the new smaller body contour, and that's usually 4 to 6 weeks. So those are more springtime things that we do. We do them all summer long because people are frustrated with, I want that gone. And if it's a small amount, it's less time. It's usually 3 to 4 weeks, and that's okay. But there are non-invasive treatments that we can do as well. Cool sculpting is the #1 body contouring non-invasive treatment out there right now. I actually have what's called dual sculpting. We have 2 units, so you can do one on each love handle at the same time. It will help freeze those fat cells that your body will slowly resorb over time. The treatments take about 35 minutes in the office. It is cold, I will tell you that, and it stings a little bit, but after that, your body will resorb those fat cells slowly over another month. It targets 25% of the fat cells, whereas liposuction will get 60 to 80% of the fat cells. So those are 2 really good ways. The third way is only FDA approved for the chin, or the neck, submental fullness, and it's called Kybella. It's basically deoxycholic acid that basically destroys fat cells. You inject it in there, your body makes it naturally, but this is not from your body, it's produced in the lab, and we inject it in there. It's a series of injections, takes me about 15 minutes to do it once. You wait a month to 6 weeks, and people come back and do that again. Now, off-label is used in other areas like the bra line and some of the waistline, but that is a little more subtle than the other 2 procedures I talked about.
So go ahead, Dr. Shamsi.
So my question would be, how do you decide between cool sculpting and liposuction?
Well, most people that have fat are candidates for both.
Okay.
For health reasons, they just have to be willing to do the downtime for the liposuction. And a lot of people aren't. It's like, I don't have time to wear that garment, I'm not going to do that. Let's just go do the cool sculpting and I'll come back. The results take longer to get where I can get. With liposuction in an hour, will take you several months. With cool sculpting,
They can do it during their lunch break or minimal time.
That's why it's so popular. It's like, I know it's not liposuction, but I'm getting not halfway, but I'm getting somewhere with and no downtime. And you can continue to work out at the gym, no time off.
I was just about to ask you that. You can continue to still do the things that you want to do.
Yeah, absolutely. Same day, next day.
I said, it's interesting when I think about your beach body, again, a lot of us focus on that midsection, but there's other ways you do it, the double chins, things like that, other stubborn, unwanted diet and exercise resistant areas of fat.
Yeah.
And goes from there, so that's great.
My #1 beach body fix is breast augmentation, but that's not what this is about today.
No, not today's show, but that's all right. Maybe we'll have a future show to Tear Up with Dr. G about breast augmentation.
Actually, one more question.
Please go right ahead.
So after liposuction, to keep the weight off, do you recommend them to lower their calories, or is there?
Right, they need to maintain.
Okay.
Okay, because you can gain it back, and it's just like you can out-eat any exercise program. You can out-eat liposuction, but you will not gain the weight in the same areas that we treated as fast as you would have before.
Okay.
So, for example, we'll do a liposuction of the abdomen and the waistline, and then people will come back. It's like, okay, I'm 5 pounds lighter. 3 months later, it's like, you know what? I'm gaining weight again. Okay, it's not coming back.
It's not coming in the waistline. Yeah, it's coming in the
lateral
area.
thighs and in the buttocks area. And sometimes it's a good thing. Sometimes it's not such a good thing.
So then you would just do retreatment in those other areas where things are
Right.
coming back. Fair enough.
But at some point, you need to maintain your weight.
Yeah, we'll talk a little bit in a bit about some of the diet fads and some long-term effects, especially when you're trying to do some caloric restriction to maintain down the line. Let me ask this question to Kendrick. Kendrick, how do you address stubborn, diet-resistant, exercise-resistant areas of fat? What's kind of your approach to that from a fitness standpoint?
Well, are you talking about from a client's perspective?
Yeah. And how do you better target those areas? So a lot of people are saying, okay, I want to work my midsection, or I want to work on the fat underneath by my triceps, or some of those lateral of those side the thighs. How do some of those areas can be very stubborn for people, the obliques. How do you really try to focus on that?
So a lot of times, first off, when I meet with clients, I already let them know that with training we can't do a lot of spot checking. So the average person, they store fat in their midsection, in the back of their arms, in their hips and their legs. And I generally tell people that those are areas of concern that tend to weed off with nutrition, has been done well over a long period of time. But just to get them more definition and some muscle in that area, you have to be very creative with the static holds. So with my training, I'm a real big fan of isometric static holding and constantly stressing the muscle for a long period of time and engaging their core. So not really the biggest fan of actual sit-ups or actual ab workouts, because when your stomach doesn't look the way you would like it to, i.e., you have too much body fat there, you can actually develop too much muscle under that fat, and now you're stuck with a gut. You see it a lot of times with a lot of fit people in the gym. They can't get rid of that gut, although they're very, very strong people, very, very fit people, because they focus too much on abdominal muscle growth and not enough on core stabilization. The more I can stress that core and the more I can hone into their nutrition over a long period of time, then they'll start to see a lot of those spots eradicate over a period of time. But it is frustrating for a lot of people in the beginning.
On a side note, it just made me think of something. It's like if a guy had a lot of hair on his abdomen, if you shave that down, would you be able to see those abs? I just joking. Don't answer that question. All right. So let me ask you. Let me come right back at you, Kendrick. So we're talking about Beachbody again. You guys are listening to us here live on Facebook. We're here in Student Intellectual Radio. What are the best exercises that people can do to really get their Beachbody back? Are there things that that it's like your go-to to tell your clients or people that are listening to the show right now, things that you can do right now to start jump-starting your Beachbody look?
Oh yeah, 100%. So especially for people who don't have access to a gym, if you really want the Beachbody look and to jumpstart your fitness, I highly recommend circuit training. Circuit training is awesome because it's going to allow you to get your heart rate up and maintain it at a level where you're constantly burning fat even after the workout. And a lot of times with that circuit training, I like to cycle between both an intense interval-like movement as far as getting their heart rate up, and then cycling off of that and making the next movement more of a strength training element. So I guess something generic that I would do would be having somebody do jumping jacks to get their heart rate up, and then from the jumping jacks go into something more functional and strength training building, like push-ups that works on their triceps, their shoulders, their chest, and their back. Then from there, go back to something to get their heart rate up, like high knees or sprinting, and then down to something where, again, they're back to functional strength training, i.e. squats or pull-ups, something along those lines. So I truly believe that get yourself jump-started, maybe to make yourself feel more comfortable from a fitness element before you make that commitment to get a gym membership. Start with circuit training at your house, 25, 30 minutes. Get your functional strength level up, and then when you have access to a gym, you can use that same type of component of training with HIIT training with free weights. And that's the next level of really challenging that workout. So squats, push-ups, pull-ups, lunges, and anything that gets your heart rate up for over 20, 25 minutes is what's going to help you jumpstart your metabolism and rid yourself a little bit of fat.
Excellent. Go ahead, Dr. Bull.
Mountain climbers.
Mountain climbers.
Kendrick made me do a lot of mountain climbers, by the way, when he was training me.
Knee cups.
Oh yeah, well you made me do a lot of things, and I just like, ow, it really hurts. But you're right. One of the things I'll piggyback on. We get asked those kind of questions a lot. It's like, doctor, what kind of exercise should I do? Right. And of course, none of us here on this panel have a credential in exercise except for Kendrick. But like none of us have those credentials. So we wind up doing very generic advice. Right. And we say try something that's easy to learn, because if you do something that's more difficult, you're likely not going to stick to it. And we say take your time, gradually work into it. But this is why we have to have these kind of conversations, to know that you have to have a village to help you out. Dr. Bull, go ahead.
I like that approach though. Start at home,
Yeah.
even if it's with a DVD that you can follow. Get your confidence up. You won't, some people do, stay with that forever, but then join a gym, and then you'll keep changing what you're doing. You can't get in a routine and stay in it, because you'll hit a plateau.
Yeah.
Both
But
with
you'll hit a
exercising
plateau.
and body change.
You'll hit that plateau, and then you're going to get more frustrated, and then it's like, okay, I'm going to go back to these old habits.
Right.
Right.
What's your thoughts, Dr. Shamsi?
No,
Correct.
I agree 100%. You can watch, use your smartphone, you can use your tablet, your smart TV. But once you're done, when you go to a gym, and if you actually ask for help, if you ask a personal trainer, they'll find muscles that you weren't not working out before, and you'll feel like, you'll feel
You're sore.
You're sore, and you're like, holy, I did not know I had these muscles. I did Pilates with my wife, and I thought Pilates is easy, but no, you really feel it. We were on a reformer, and it was amazing.
Well, I mean, but that's the beauty of it. I mean, just as I said earlier, move more, eat better, stress less, but you're moving. And I would say, just find something that you're passionate about, something that you want to do. It doesn't matter, even if I just want you to move. I think if we can start that, then we can build off of that. And hopefully the ends justify the means. And then that those endorphins that get released as you start having that pleasurability, and hopefully that sustains you to want to do it again and more often.
Absolutely.
And so let me ask this question to Dr. Shamsi. We're talking about, again, Beachbody. We talked a little bit about fitness. We talked some things that you guys do in particular. Let's talk a little bit about nutrition.
Sure.
There's some of those fad diets that are out there. Celebrities are making them famous, and everybody's doing it. Everybody's jumping on the bandwagon. I'm talking about intermittent fasting. We're talking about ketogenic diets. Why don't we kind of break it down for me a little bit? Can you talk about a little bit what intermittent fasting is?
Sure. So intermittent fasting is all about taking care of those insulin spikes. For example, every time you have a meal, you might get an insulin spike. And so insulin actually blocks an enzyme that breaks down fat. So for example, you have breakfast and you have a bowl of cereal, so you'll get that insulin spike. And so once you have the insulin spike, you're probably not going to have some fat breakdown for the next couple hours. You have lunch, another insulin spike, and then you might have a snack. So when you intermittent fast, you cut out 2 or 3 of those insulin spikes, giving time for your liver to process some of those fats and to for energy to come from different sources other than your food. And so it works well. It's I believe it's from my experience, it really helps with central adiposity more than generalized weight loss. You have a little bit of belly fat, and so the intermittent fasting is the way to go. It's all about patience, though, and it's not one of those diets where you start losing quick, weight. Maybe something like the Atkins, or there's other keto diets that you may lose weight quicker with. But intermittent fasting is it's a good diet for the right person.
Yeah, there's a couple different techniques, and patients ask me this all the time from an internal standpoint. Should I be doing intermittent fasting? And I always say, let's start from the beginning. It's really an eating pattern. And that's how I kind of describe it. I don't really describe it as a diet per se,
Sure.
but an eating pattern. The most common thing that we see people will do like a 16-8, and that means 16 hours of not eating and 8 hours of eating. And so you may start eating at noon, from noon to 8 o'clock, noon to 8 p.m. That's when you have your food in you, and you're not doing anything else. Maybe the next morning you have some black coffee or some green tea or some water just to hold you over. But you're really kind of restricting those calories. There's 2 other types of intermittent fasting that are out there. There's the eat, stop, eat method, and that's where basically you're fasting for 24 hours twice a week. And then the other 5 days of the week, you're not doing that kind of thing, but just kind of eat, stop, and then eat. And then the last one's called the 5-2 diet, and that's where a person consumes about 500, 600 calories on 2 non-consecutive days of the week, and then they eat normally the other 5 days. So they're different things, but the most common is the 16-8 method that they're doing. Do we know of any, one of the things that, one of my things that I have in my reservations is in certain populations that you need to eat. And so I think about some of my brittle diabetics. I think about them. I don't know if they should be going 16 hours without having something, especially people that are insulin dependent. But I also think about people that have tendencies for hypotension, low blood pressure. I don't know if that person should be. I mean, of course, people that are out there listening to us, talk to your doctor. We're just having a conversation here, but talk to your doctor whether any of these techniques are right for you. So there may be some populations. Have you seen some other populations that maybe want to just I exercise a little bit of reservation or a little bit caution?
Absolutely, with especially with your insulin-dependent diabetics, with the elderly, you have to be very careful. And so, one diet is not the best diet for everybody. You have to modify it, and it's important to talk to your provider or talk to a specialist to figure out, is it the Mediterranean, is it is it low calorie? And first of all, the most important thing is, let's work on your food diary. Let's do a 24-hour food recall and figure out, is it calories? Is it fat? Is it carbs? Is it something else that we're missing here? And once a specialist can explain that to you, maybe you're carving it up a little too much, maybe we need to fine tune it. I'm not one of those guys that cuts out all total carbs. I'm not one of those guys that cuts out total fats, because I believe that you need it. Our brain runs off of carbohydrates, our muscles run off of carbs. But let me educate you on what are some healthier carbohydrates.
Yeah. And I would say I don't want to deprive some of my patients from some of the health benefits of some of those healthy carbs.
Absolutely.
Think about your legumes. By the way, I think as a society we've gotten away from eating legumes. We've gotten away from eating some of that stuff. We've got away from eating your quinoa, your lentils, your farro, some of these whole grains that I think are really high quality. We also got away from eating vegetables. And like your kale, your Swiss chard, you got to eat that kind of stuff. And your berries,
Sure.
The nutrient density, but also some of the fiber content of those things can certainly help stabilize blood sugar. So I'm like, we got to get back to legumes. Everybody out there, legumes miss you. They really do. Also, they have an amazing effect on not only keeping you full, but also can help out with your carbon footprint, reducing your carbon footprint, people. No doubt about that. So the other diet that people talk about is the ketogenic diet. That's another thing that's being made famous by a lot of celebrities, and the kind of general idea is you have kind of these high fats, these moderate amount of proteins, and then you really restrict those carbohydrates and force the body into a state called ketosis, where you're using other forms of energy, not necessarily glucose as your energy source. A lot of people are doing that kind of stuff. Do you find people trying to ask you those kind of questions? Anybody on the panel, whether Kendrick, you or Dr. Bull or Dr. Shamsi, anybody coming at you guys about, hey, let's do keto? Is it right for me?
No, absolutely. Keto's been around forever. It was called the Atkins diet before they turned into keto, and before that, they used to treat low carb diets. It's basically a low carb diet, and the name will keep on changing, by the way.
Exactly.
And it's once again, as we discussed earlier, it's not about weight loss short term; it's about long term. And so, how long can this person last on a low carb diet is what I've run into.
Excellent. Well, thanks for Dr. Bull, go ahead.
The last one I saw was the Keto for Life, and I was interested in it. And they have an entire website, and now it's on Pinterest. There's a lot of things that you can do, and how to take the carbohydrates out of pizza, how to take the carbohydrates out of pretty much anything you could eat. And I like the pizza idea, because it's a chicken-based crust. But some of those things, I don't know how long you can actually continue to do that. While there are people that have done it for 5 years, maybe, the average person is probably not going to be able to stick to it.
Yeah, I think about total
Yeah,
impact.
I was
Go
wondering
ahead,
from a
Kendrick.
medical perspective.
Please.
I'm sorry. I
Go
was
ahead.
wondering from a medical perspective, when does their cholesterol, especially when people are doing the keto diet, and they're not properly educated on the types of fats they should be consuming, and they go a little bit too heavy in those processed bad fats. How do we reel them back in to let them understand that their cholesterol and all those things, their health in the long run, is being compromised?
Yeah, that's a good question. I'll answer that one. You're looking at basically from an LDL profile. When you're doing a lot of fats, you can certainly raise that LDL. You actually want to be careful in some people that are at risk for going high fat. You're missing a lot of fiber to help just to help keep you full and not eat a lot of high fat sources. But you always worry about will somebody cardiovascular wise, if they're going to have increased LDL, the bad cholesterol, not necessarily HDL. There hasn't been good studies actually when you review the literature on both of these. There actually haven't been really good randomized trials out there. They always say about the medical community, we're always slow because we always have to have a randomized trial. Why can't we just fly by the seat of our pants? Well, we don't do it like that. And that's why some people are mad at us, but that's a whole other story for a whole other day. But I haven't seen any good data out there, Kendrick, that are published trials on people doing ketogenic or intermittent fasting. Part of it would be, it might be hard to design something like that, and it certainly can be kind of costly. But from my own practical perspective, I don't have too many patients that have come in and said, hey, Dr. G, I want to do ketogenic or I want to do intermittent fasting, and then you fill out their lipids over time. And I always kind of say, first and foremost, your diet needs to be foundational. And all the major guidelines, even the American Diabetes Association has come out and said, hey, we just want you to have a healthy diet. And then when I think about a healthy diet, I've done a couple shows about plant-based nutrition and cardiovascular health, and I would refer people back to those shows on my website to talk about some more of the details. How can you have, a predominantly plant-based diet with minimal animal products and minimal processed foods? and that's where we talk about the blue zones, people that live the longest and with the least amount of medical burden. They follow those kind of dietary plans. So that's my answer, long-winded answer to the question. Let me ask you a quick question, Dr. Shamsi, and Dr. Bull. I want you to piggyback on this too. What's the role of like water, sleep, that kind of stuff, other things that we're talking about to help get that beach body?
No,
Stress management too.
Two of the major reasons why people might have a hard time losing weight is number one, if you don't sleep well. If you don't sleep well, you're not going to function well. The weather's nice, you want to go up, you don't have any energy to. So what happens is, number two is stress and depression. And so sleep is a huge part of feeling healthy and feeling just better and getting the energy to get out and do so much more. So sleep is definitely on top of my list.
Okay, Dr. Boone, what's your thoughts about other kind of things, lifestyle things, water, sleep, stress management, that kind of stuff, recovery time?
Absolutely, you need to have recovery time. Water is key to losing weight. In general, everyone needs at least 64 ounces of water a day.
Correct.
Minimum. If you're sweating out a lot more, you need to drink a lot more. And your body will tell you, but people tend to ignore that. And drink Diet Coke and other things that aren't really the same, and it's not really solving the issue of thirst and dehydration.
Kendrick, from a fitness standpoint, what's your thought when you educate your clients about these other lifestyle factors, water, sleep management, recovery time? How often should a person be exercising? Can they exercise every day? Do they need to have some recovery? What's your general thoughts on that real quick?
I think it depends on the type of workouts you're doing. I always highly recommend a minimum of 3 times a day, 3 times a week. But I think it depends on the type of training you're doing. So if you're doing a little bit more on the full body, getting your heart rate up and implementing weight training, I think a minimum of 3 days a week can essentially help you with that. If you're focusing strictly on weight training only and being very specific about the muscle groups that you're targeting, then you can if done smartly, can work out every day. But the only thing about working out every day is, just like the doctors just explained, all the other things have to be in play. They have to make sure that they have an ample amount of water intake. They have to be getting close to 7 to 8 hours of sleep to make sure they're recovering, and their macronutrients have to be hit on a daily basis. And knowing when to crank the intensity on a workout, and knowing when to lower the intensity of the workout. So coming from myself, I think anywhere between 3 to 5 days is plenty.
Excellent. Let me ask this quick question, Dr. Shamsi, then we're going to get into some myths versus facts. So, Dr. Shamsi, what's your approach when somebody hits that plateau? They got 10 more pounds to lose. We're all been there. We're all probably sitting here right now. We all got 10 pounds to lose. But what's your advice to people that are out there that hit that plateau? They know they just got to get 10 more pounds off. How do we get somebody through that?
So when you're asking a physician who specializes in obesity medicine, that's when I start pulling out my medications. Okay. And I talk to them about different options. There's many different medications in the market. I know many patients are nervous or have heard myths about certain medications, but when you explain to them, I think that's they feel more comfortable. And from my experience, I've seen even more than 10 pounds possibly even being lost.
Excellent. And I want to refer everybody back to, I asked that question to Kendrick on my video that I did on Monday, so go ahead and refer back to that video for some more specific details. I want to get into some myth versus facts. What I do each week on the show, we have something called myth versus facts to really set the record straight. You're hearing some great discussion from the experts, but I want to make sure you guys have the right information. Remember, Dr. Google is not the answer to everything, so I want people to get the right information. So here, what I do is I'll say a statement, and then I'll have our guests say either myth or fact. It'll be kind of rapid fire, bam, 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 and give us a few sentences on why that's a myth or a fact. So here we go. Dr. Shamsi, first question to you. What am I talking about? This is a statement. Here we go. Myth or fact? Here we go. Obesity remains largely underdiagnosed and undertreated. Myth or fact?
Fact.
Excellent. Please explain.
35% of the population is obese. If you add in overweight, it's 60%. And I feel, from studies that have been done, only 1 to 2% of those people are actually seeking treatment.
Excellent, thank you. Dr. Bull, here's your statement, myth or fact. Eat healthy, stay active, be smoke-free, and limit alcohol use to help sustain the beach body you desire.
Fact.
Thank you, please explain.
Well, that's the whole idea of getting that beach body and feeling good and healthy about yourself. Alcohol is a depressant. Try to limit consumption of that. You need to get enough sleep so that your cortisol levels come down, which will help you lose weight. I don't want to get into too much detail, but exercising makes you feel better. And having a healthy diet will maintain your health for long term.
Excellent. Here we go. Here's a statement for Kendrick. Here we go. Adding weight significantly increases the number of calories burned during a cardio workout. Is that a myth or a fact? Or maybe somewhere in the middle?
Oh, I'm gonna say somewhere in the middle, but I would go more on the fat side actually. Now that I think about it, because I'm always a fan of, especially in cardio, implementing some form of resistance training like rowing or the Airdyne bike, where that way you're working a little bit harder, and of course, the more lean muscle you build, the more calories you burn from doing simple activities. So I would say that's a fact.
Yeah, and in general, you get about 10 to 20 extra calories that are burned during recovery for every 100 calories you expend during an exercise bout, and that's depending, of course, on intensity of your exercise. All right, here's the next statement for Dr. Shamsi. Here we go. I like this one. This is good. I like this. Myth or fact? Healthy eating is complex and challenging.
It's definitely in the middle. The first thing is, what does healthy eating even mean? To every single person out there, it's different. For some people, it's really sad when you actually sit down with the patient and they say, like, they tell you, like, what they think was healthy, it really is not the best choice. And so it's our job to help explain that to them. So that's why, it's definitely in the middle.
Thank you very much. Here we go, Dr. Bull. Here's a statement. To lose weight, I have to give up all of my favorite foods.
That's a myth.
Please explain.
Portion control goes a long way into maintaining your caloric intake and the ability to maintain this diet. If you're always sacrificing the things you really love to eat, you're setting yourself up for failure. A small portion is still acceptable, no matter what it is. Chocolate cake, apple pie, ice cream. You just have to account for those calories and make it up. And that's the Weight Watcher program sort of does that. You can have that piece of cake, but that's all you're going to get today. Well, not really, but I'm exaggerating a little bit. But you get the point. You get the point.
Yeah, absolutely. And I always say I found like this 80, me personally, I call myself a flexitarian. I found this kind of 80-20 rule, but I try to make sure that, yes, 80% of the time I'm doing the right things, and then to maintain my sanity, and 20% of the time I allow a little freedoms there, but I try to back it up. But if somebody has a significant medical issue, don't get me wrong, somebody's got cardiovascular disease or chronic kidney disease or diabetes, you have to be much more rigid in your approach because you already have a disease process that's there. And certainly if you have even more things like end-stage renal disease or congestive heart failure, you have to be much more rigid in your approach. So don't get us wrong on that one. You have to actually be a lot more rigid. Here we go, Kendrick, myth or fact, here we go. In order to obtain a beach body, I must work out 1 hour per day.
Oh, that's fiction. That's fiction, and that's honestly because you have to work smarter, not harder. A lot of times, most workouts really you don't even need to work out from. I would say a minimum of 30 minutes. So you don't have to work out for an hour, and that's where a lot of people they come into that difficult situation because they're not educated on how to do anything less than an hour. So 30 minutes, be efficient, have a goal set, target those muscle groups, get your heart rate up, work as hard as you can for that time frame, and you'll probably see I would say the same amount of results you get out of a slower tempo hour workout targeting those same muscle groups.
Excellent. I'll say, give a piggyback real quick. The human body is very phenomenal and very miraculous. We can eat a burger. We can eat a 500-calorie burger in 3 minutes. That is efficient, without a doubt. But to do a 500-calorie workout, that takes a lot more time. That is not efficient. And certainly, but if you want to push it really hard, you can either do that 500-calorie workout in 30 minutes if you're really pushing, and you might not need to be able to push, because I think about people that have weight challenges or joint challenges, you can't push like that, or if you do a low intensity. But I always find that fascinating. We can eat a burger in 3 minutes. That is efficient. Wow. Okay, here we go. A couple more of these. Dr. Shamsi, here we go. Statement: breakfast should not be skipped. Myth or fact?
So once again, it depends on what you're doing. Yeah. Are you doing your intermittent fasting, or are you just trying to eat healthy in general? I'm a big breakfast fan. I promote breakfast, and obviously the right breakfast for that person.
Excellent. All right, Dr. Bull, here we go. Statement: lifting weights are not a good way to improve your health or lose weight because it'll make you bulk up.
Absolutely not true. There are certain people that gets into body types, but basically pay attention to what's going on. There are different ways of lifting weights, but the resistance training can be done so that you won't bulk up. Because I hear that a lot. I don't want to lift weights because I don't want to be too big. Well, that's not necessarily the case.
Excellent. And then we'll do the last one for Kendrick. Here's a statement, myth or fact. Hiring a trainer is enough to hit your weight loss goals.
Oh man, that is so.
You're like, of
tough.
course I want people to hire
I-
me. Absolutely.
Unfortunately, that is fiction because a trainer can only do so much. Even the best trainers in the world, they can hold you accountable to the best of their ability. They can give you the best workout. But if that client doesn't make the necessary steps to handle their lifestyle change as far as alcohol consumption, water consumption, the type of food they're eating when they're not with a trainer, they won't lose the weight.
All right.
They'll get in great shape, though.
Yeah. Well, thank you. There you go, everybody. We got myths versus facts done again. Hey, we got about 5 minutes left. So what I want to do is kind of close this down. You know, in the beginning, we talked about the chief complaint, why people are coming in, the question of the day, what are some tips they can do to help get that beach body going? When people leave our offices, we call that the assessment and plan. That's where we give people their diagnosis, their plan, and the most important thing, a follow-up. Gotta have a follow-up. So let's bring this on home. Kendrick, I'll start with you on the phone. Give us a couple take-home points for people to be successful in getting that perfect summertime body.
Oh man, a couple of tips I would tell you is that first off, decide how many days that you can commit to yourself. Once you figure out how many days you can accurately and successfully commit per week from an exercise standpoint, then it's about holding yourself accountable with that and being patient and understanding that this is a long-term thing and not a short-term thing. And once those 21 days hit, it's pretty much smooth sailing after that once you stay consistent. So first and foremost, figure out the amount of days you can commit realistically, hit those goals, commit more, hit those goals, commit more, and then everything falls into place.
Excellent. Thank you, Kendrick. And it's been a pleasure having you on the show. Don't hang up just quite yet. Dr.
Yes,
Bull,
sir.
give us a couple take-home points for people to be successful when it comes to getting that beach body.
Try to make it fun. I agree with everything Kendrick said. If it's you're not having fun, you're less likely to commit to it and stay on that path. That's my main point, because the other ones make sure that you can actually set reasonable goals for yourself, and start early.
Excellent. Thank you. And Dr. Bull, it's been a pleasure having you back on the show again. I look forward to some future collaboration as well. Dr. Shamsi, give us a couple take-home points for people to be successful, to not only maintain to get their beach body now, but also to maintain things for beyond.
You know, my take-home point is enjoy life as well, but everything should be in moderation. You know, you go to your nephew's birthday party, have a slice of cake, but it doesn't have to be the biggest slice of cake. I want you to still enjoy life, not be miserable, and go to the gym, you know, travel. I want you to dine well, live well, have a good life, and at the same time, realize that this is the long term, and this is for your future as well.
Excellent. Well, thank you, Dr. Shamsi, for being on the show. You know, my final words are this. You know, I always think about this. Total impact. I want you to keep those words in your mind, because we're looking at everything, but have that goal in mind. But remember, you got to start like this. What do you want to do? Why do you want to do it? And then we can help you out with the how. The what, the why, the how. We all have reasons to do the things that we want to do in life. We want to be intentional in our efforts. We're doing things for others, we're doing things, but most importantly, we're doing things for ourselves. So ask yourself, think about total impact. What do you want to do? Why are you doing it? And then how we're going to do it. And I think if you keep that perspective, we're going to help you out and get to your health goals. So I want to thank my panelists today. We've got Mr. Kendrick Butler, who's on the phone, personal trainer. Follow him on Instagram @FitLifeKen. Thank you, Kendrick. My good friend, Dr. John Bull, board-certified plastic and reconstructive surgeon, founder and owner of the John Bull Center for Cosmetic Surgery and Laser Medi-Spa. I've sent a ton of pages over to him. Check him out. He's awesome. www.dupageplastics.com. My good friend, Dr. Omar Shamsi. He's also seen a ton of my patients. Check him out as well, too. He's a board-certified medical bariatrician, medical director, Endeavor Health Weight Management, Edward-Elmhurst Health. Check him out, www.eehealth.org. Hey, everybody. You've been listening and watching live on Facebook and intellectualradio.com. This episode is written by myself, Mark D. Gomez, MD, and Tiffany E.R. Gomez. Producer is Tiffany E.R. Gomez. Music is by the wonderful Mr. Havis. Copyright 2019 by MDG Wellness LLC. All rights reserved. Stay tuned for my next episode. We're going to keep this countdown to summer series going on next week. Part 2, last minute skin prep. Hey, if you enjoyed today's show, please be sure to like and share it on social media. Audio replay is available on your favorite podcasting app. Simply search for To Your Health with Dr. G, subscribe, and press play. Don't forget to check out my e-commerce store on my website, www.drmarkgomez.com, to get some awesome To Your Health with Dr. G swag. These are available, these awesome coffee mugs that we're drinking out of. And let's keep this health revolution going strong. All right, everybody? I'll catch you guys next week. Peace out.
Peace.